Today I'd like to give a short presentation on paediatric radiography, and we'll address these 5 considerations. Preparation of the room is as for an adult. However, it is advisable to have some gender-neutral toys in the room to act as distractors during the procedure. Communication is twofold. A radiographer must be able to communicate clearly in a way which is appropriate to the child's age, and you may feel the need to image a toy, especially if the patient brings it into the room. The radiographer must also communicate with the child's carers. Their understanding and cooperation, not to mention consent, is vital for success. Parents are the best form of immobilisation, and it is important to stress that the patient must keep still. If, as one of your other methods of immobilisation, you're going to use tape, then check for any allergies first. The best radiation protection is the avoidance of an examination, and certainly in hip pain in the under 2s, ultrasound is the modality of choice. Comparison views should be avoided at all cost, even as far back as 1979. In a review of 300 cases, 8% of which were sent for comparison views, in no case was the management of the patient altered by this extra imaging. Gonads of the child should always be shielded. However, there is a great risk of shielding failure, in fact up to 85% in females. In this regard, many departments have a first visit pelvis no shield policy. No talk on paediatric radiography would be complete without mentioning non-accidental injury. However, this is really a subject in its own right. The radiographer may be the first person to raise concerns, and therefore it is important that you can recognise these pathologies. In fact, ASMERT have now decided that graduating radiographers should have an element of radiological knowledge, and the initiative by Mike Neep of PAE, preliminary image evaluation, is being put forward. Obviously, I can't talk about all those pathologies. However, this one is probably the most suggestive of a non-accidental injury, the so-called bucket handle fracture. And here we have a loose line through the metaphysis, and hence the proximal element of the fracture represents the handle of a bucket. This image is highly suggestive of non-accidental injury. Whilst you can angle the tube in different ways because of patient non-compliance or use horizontal beam imaging, you may want to consider your mode of work. Here we have an AP view of the clavicle, which is the most fractured bone in the shoulder girdle of paediatrics. Here we can see no disruption in the cortex, no loose line to suggest a fracture, but in this region we have an area of sclerosis, and this is an important facet of radiological evaluation. When you have looked at an image and decided on abnormality or normality, always check bone texture. We do the lordotic view, and here we can see clearly a fracture at the junction of the middle and lateral thirds. You could change your work method, undertake the lordotic view first, which negates the need for the AP view, and hence you have reduced the radiation exposure by 50%. In this case, a child has a radiopate mass in the mid and lower zones of the right lung. Initially, you would think, I must do a right lateral. However, if we look closely, we can see the right heart border. The heart is an anterior structure, and advanced radiology, the silhouette sign. If this mass was anterior, it would abut the right heart border and you wouldn't see it. Therefore, this radiopate lesion must be posterior, and the subsequent lateral proves the fact. Therefore, I can suggest that the lateral is unnecessary. Added to this, of course, is this patient is likely to go to CT, where you will garner much more information. In summary, I've talked about preparation of the room and communication with the patient and the caregiver. radiation protection, non-accidental injury, adaptation of your technique, whether it by altering tube position or altering your mode of work, and we have discussed 3 radiological cases. Thank you. Are there any questions? References and bibliography follow.